Hi, Rowdy again. Remember, we were talking about the care cabin, and there are a few things more I want you to know about it. We talked about the hours at the care cabin being from 8 a.m. to whenever the last campfire is. 8 a.m. is kind of important because there are nurses that live inside the care cabin. So they need to get up in the morning, get showered, and get dressed. So if you get there before that, it's a little difficult for them to be ready for the day. However, anytime you need the care cabin, you can get in by knocking at the door. If the door is locked, that means the nurses aren't ready for you, but you knock and you wait patiently for them to get there. You knock really hard because they're in another room. You need to knock loudly. The care cabin doesn't have nurses in it when there are all camp activities because nurses like to go to all camp activities. And so anytime that you come during a camp activity and the door is locked, and it probably means there's nobody there. The nurses are on walkie-talkies, so if you need us, find somebody with a walkie-talkie and find us. We'll get to you immediately. Okay, we were talking about schedules. You have medicines that are on schedule and some that aren't. At the beginning of camp, you will be given a list. Your counselor and your unit leaders will have lists of when your kids are coming to the care cabin. It's your responsibility to get the kids to the care cabin around those times for their medications. If they don't come, we will find you if it's necessary for the medicines. Some of them are not so important that we might not let it go if it's late at night and you've forgotten something that isn't important. If it is important, we'll call you and you'll be coming to the care cabin. Never come to the care, a camper never comes to the care cabin alone, always escorted. And if he comes with another camper, they both have to let you know that they're where they're going and what's going on with them. So when they come to the care cabin, they're going to pull a card that has their name on it, hand it to the nurse. That's the way we know which camper is standing in front of us. And even if we've known this camper since he was a little pup, we're going to ask for that card every single time. Another important thing about the care cabin is that when your camper comes to the care cabin to get medication, they bring their water bottle with them. They don't come without it. Actually, they don't go anywhere without their water bottle because you're going to be drinking 4 ounces every hour, maybe up to 8. You need to have that water bottle with you. One of the things that sometimes happens is that the care cabin gets really busy and gets really full. So if you come to the care cabin with your group of campers and 2 of your kids have medicines due and you see a lot of kids inside, will all the rest of your campers that don't have medicines due stay outside? And the ones that have medicines come inside, get their card, hand it to a nurse, and then they'll be out. The rest of you will wait outside patiently for that. There is a scrub station outside the nurses' quarters, outside the care cabin. And that scrub station just has water and a few pieces of gauze and some gloves. And it's a place for you to come to take care of the scrapes and scratches that are really minor that you don't need to see a nurse for, or you feel that doesn't need to come into the care cabin. If you clean it up and you don't like the looks of it, or you're worried about how it looks, or you think it needs more than you've done, then come on into the care cabin. But you can use the scrub station for the really minor things that are there. First aid kits. You're all going to be issued a first aid kit there's one in each cabin, and then there are extra ones around, like on the golf carts and down at the water and different places like that are first aid kits. Whenever your group is out traveling, your first aid kit goes with you so that you always have it. What's inside? Well, not a lot. So don't have great expectations, but there are some important things in it. There's some gauze. There's a big gauze. It's in the form of a sanitary pad. And the reason for that is that a sanitary pad is a really good thing if you have a lot of bleeding. So if you had a kid fall down and you really have a lot of bleeding, grab that pad and open it up. It's sterile. It's ready to slap right on the wound and put some pressure right on top of it, and get them to us. But there's an important thing you're going to do first. One of the most important things that's inside your kit is are gloves. There are gloves in every kit, and you will never, ever, 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 ever start treating the child's wound until you put a pair of gloves on. Nobody's ever bled to death while somebody grabbed a pair of gloves and stuck them on really, really fast. It's very important that you protect yourself from the possibilities of the things that are going on inside that kiddo's blood, and you want really to be very careful. The same is true when you're protecting yourself from other things that happen that may not have to do with blood. You may run into a few other things in the possibility of process of being at camp. Kids might vomit, ooh, ick. They might spit up, ooh, ick. They might have some other ooh, ick things that happen to them. You know, they didn't quite get to the bathroom on time or whatever. And you may need to help with those pieces. But the first thing you're going to do is put on a pair of gloves. Really important to protect yourself first. One of the important places in camp is called the Cove. And the Cove is a nice, quiet, cool place that is a great place to curl up and take a nap or just have some downtime. So we try to build downtime in for all of us because we all need rest when we're at camp because we're all really busy. But if you have a camper that needs extra downtime, needs more sleep, just needs to sit out for a little while, the Cove is a good place for them. And if it doesn't have a staff member there, then you need to call your unit leader and let's get somebody there. You can't just leave a camper there, but it's a better place for the camper than to bring them to the care cabin. So if you have a question about whether or not they should come to the care cabin or to the Cove, you can call the nurses and talk it over with us, and we'll probably find out that the Cove is a good place. Some of our campers have IV lines, and I'm not going to talk very much about them, but you will have a chance at camp to ask me a lot of questions or other nurses, and so please feel free to ask anything you want to know. There's just two things I want you to know about the IV lines. There's two different kinds of IV lines that they might have. One might be external, and if they have an external line, it's probably coming out someplace on their chest, and it's going to have a dressing over it, and then you're just going to see this little tube thing, kind of thing hanging out there. The other kind of IV might not even be seen. It's called a port, and it's under the skin. And unless they have a needle in it to access it, to be giving medication at the very moment, you won't really know that they have it. You might see a little circle and wonder what that's all about. That might be their port. Two things important about either one of those IVs. No direct contact on those. No balls being thrown right at those chests. No roughhousing. We're going to come back to the roughhousing idea. No pulling on those lines in any way. And if those dressings that you see on top of the external port or the external IV, if that dressing is pulling up or looking dirty, you need to come up to the care cabin and we'll change it. I'll have some examples at camp, but you can come and we'll talk more about the kinds of IVs. And you may not see anybody with them, or we may have several. We never know. One of the things that's important for us to pay attention to at camp is fracture risks. Any child who has had cancer has a higher risk of fracture than a child who hasn't had cancer. And so there are some really good reasons for that have to do with the radiation and the chemotherapy that they've had, some of the other medications that they may have been on, some of the protocols they've been on, and some of the things that cancer does to our bodies. The thing that's important for us to know is that these are considered fragile bones. And that's for a child who is immediately out of therapy or still in therapy, and sometimes for many, many years after that. What I want you to know is this particular camp is not a great place for roughhousing. We don't do wrestling matches. We're very careful about how we throw things at each other and how we are hit and all of those things. So, for instance, swinging something is a way that we have had fractures in the past because it actually hit an arm in the process of swinging and fractured that arm. Didn't take much to do that. So please be careful. These are not normal bones, and we want to be very careful about that. It's possible that some of the campers you will work with have seizure disorders or have propensities to seizures. If you ever see a seizure, all you need to do is to keep the child safe. So you would lower the child to a lying position, turn them on their side if they're on their back. That's all. You do not put your fingers in their mouths. You don't do anything else except wait for that seizure to subside and then get the child transported to the care cabin. We also need to be aware of ticks. It's hot in the woods, and so the ticks love the hot season. If you find a tick on a camper or on yourself, you want to be sure and come to the care cabin, and we will take care of it from there. Ticks like places that are warm and wet, moist, like at the base of our hairlines. And so you might take a look at your kids at night and pull hair back and make sure that all hairlines are there. And that includes wherever you might have hair and warmth and moisture. You can figure that out. Crying, bullying, homesickness, bedwetting, all those things can happen at camp, and we need to be prepared for that as the adults around these people. We will never allow bullying. We don't bully each other, we don't bully our kiddos, and we don't allow our kiddos to bully other kiddos. So we're very cautious about that and careful about it, but if those things happen, you're going to need some discussing with your unit leaders about how to manage that and what happens with that. And the possibility is that some of those things, including homesickness, may bring the child into the care cabin. And if so, we'll be talking about some of the ways that we can manage homesickness. Sometimes we can do it by staying at camp, sometimes we can't. But you will be having you can ask for lots of help from your unit leaders about how to manage these things with your kids. One of the things that happens at camp is that girls have unexpected periods or menses. Sometimes it's the very first time they've had a period, and if so, they may be a little frightened or put off by that. Again, the care cabin's a great place to come. Nurses are pretty used to talking about this, and we've got the equipment. So if it's something that you can't manage in your cabin and you want some help, come to the care cabin. We are all mandatory reporters at camp for child abuse and neglect. And so it's a pretty dark subject to even think that you have to think about at camp. But if your camper talks to you about things that happen at home that are frightening to him, you need to, again, talk up your chain of command, go to your unit leader and discuss that concern with them. And anytime that you hear something about a child's home life that worries you, you need to at least let us be talking together about it. There's a really important thing happens on Wednesday at camp. There's all kinds of good things that happen at camp on Wednesdays, but the nurses call it poop day because it is the day that we get really nervous if you haven't had poops. And boy, I mean you as well as the campers. We're traveling around very fast, we're eating quickly, we're not getting as much rest as we do at home. It's hot, we're drinking a lot. We are not drinking enough. I promise none of us are. And so I want you to all think about the fact that on Wednesday, anything that looks like a stomach ache or lethargy or not feeling very good or wanting to lay out of activities, first question the nurses will ask is, when did you have your last poop? Important things that nurses care about. And then the last thing I want you to know about the care cabin is that occasionally things happen not at the care cabin that we need to hear about. So if your camper is injured or you have an unusual experience with your camper that you haven't told someone about, be sure and let us know. And particularly if it has to do with a possible injury or anything like that, be sure you let the nurses know. We were out with the boats today and somebody got clunked in the head with a boat and, you know, seemed to be okay, and we didn't bring him into the care cabin. That's okay, but please tell us about it. So we just want to know the things that happen when you're not with the campers, or when you're not in the care cabin as well. Mostly, we want the care cabin to be a place that you don't have to care about, but is a place that gives you the security, as well as your campers the security of knowing that we're ready to handle anything that's going to happen. But most of all, that you're going to avoid being at the care cabin for any length of time because you're having such a fantastic time at camp. I'll see you at Camp Journey. Bye.